My name is Kathryn Muschick. I go by Katie, and I work for the Comprehensive Sickle Cell Program here at Prisma Health. So I grew up in Pennsylvania and moved down here in the 90s, and then went to college down here, graduated in 2001 with my undergrad, and then in 2012 with my advanced degree and took boards. And I worked inpatient Children's Hospital in Greensboro for about 10 years from 2001 to 2010. And then when I graduated from Clemson, I started working here, and I've been here about 10 years. I work in the Comprehensive Sickle Cell Center. I've been doing sickle cell for about 20 years in both kids, and now I do adults. I work at the Comprehensive Sickle Cell Program. Sickle cell disease is a blood disorder that affects about 100,000 Americans in the U.S. alone. And so I've been taking care of sickle cell disease for about 20 years. I've done both inpatient and outpatient. And then in 2018, Dr. Alan Anderson started a program taking care of sickle cell patients of all ages. So he asked me to come on board to help start this program. So now we take care of sickle cell disease, all ages. And we just make sure that we give them comprehensive care. So we really look at making sure they understand their medications. We look at making sure they understand their disease. We have a social worker on board on our team. We have research on board in our team, and we just make sure that we're bringing all the new medicine and everything we can to sickle cell disease, this blood disorder. So I have worked with kids for 20 years, and I had been inpatient and outpatient. And I really enjoyed sickle cell disease and taking care of the patients and offering a comprehensive plan to people with chronic illness. And since sickle cell disease is a chronic illness, that means you have it for a long time, and people are also born with sickle cell disease. So I really enjoy being able to take care of somebody for their entire lifespan and making sure that I help them make good decisions in taking care of their chronic illness, and that ranges from anywhere to healthy living to taking their medications regularly. And so it has really brought a lot of great happiness to my job and my work ethic to be able to take care of people with a chronic illness and make their lives better daily. Inspiring and educating health is very, very important to me. I, again, have been drawn to chronic illness or to illnesses that last a long period of time because I think it's important to teach patients, to give them the tools to help them live healthy lives. And it's easy to write a prescription or give someone a medication to fix a problem, but it's much harder to sit and talk to people and educate them about their illness and educate them about the things that will help them long term. So I really try to focus on exercise, healthy living, and then taking the medications that we give you to prevent future problems. And so that has been a passion of mine kind of throughout my career, but it has really been something I can use in this particular illness. So I love, of course, spending time with my family, and I love any type of sports. So I love watching sports, I love playing sports, I love to ski, I love to watch football, of course, go to Clemson games, and anything that's physical activity is fun for me, and I enjoy doing that with my family, and traveling, of course. To make an appointment with me, please ask your primary doctor to make a referral to our office.